Hello, I am Dr. Mahesh, cardiologist from Sri Krishna Institute of Medical Sciences. Actually, today I want to talk something about the World Heart Day, which is celebrated every year on the 29th September of every year. Actually, the heart is one of the main vital organ which increase the perfusion and pumping to the blood circulation to the various organs in the body. So what it makes to maintain the good function of the heart, we need to maintain a good healthy diet, and we have to take good dietary values and nutrition values. To maintain the health of the heart, we have to change our lifestyle, and at the same time, we have to take some good nutritional products like fruits and less salt diet like that. So what happens there that one? So because heart is pumping blood to the organs, at the time it will generate some blood pressure. The blood pressure will varies from beat to beat, and usually it is in the normal levels. So whenever there is a derangement of the blood pressure, that means which maintains the high blood pressures all the time, it may lead to the some pathological changes in the vessels and various organs. So a high blood pressure may lead to the increased atherosclerosis and narrowing of the vessel, and may lead to the kidney damage, eye damage, and may lead to the peripheral arterial disease, may lead to the heart strokes, may lead to the cerebrovascular accident like brain strokes, all these things. So to maintain the proper blood pressure and to maintain the health of the heart, we have to adopt some good lifestyles and good nutrition products. So what to be done to maintain the health of the heart? So first thing what I say is only thing what we have to do, we have to maintain nutritions like low salt diet, less consumption of alcohol, and less consumption of tea, and more fiber diet. So if I say something, if it is take low salt diet, you can immediately ask what is low salt diet. It's a common question for everybody. So any person is allowed to take around 1500 milligrams per day of salt. So a salt intake more than to that up to 3 grams may lead to the various adverse effects. That means may increase the blood pressure in some patients, not all patients. To cut down the increased blood pressure, we have to take the low salt diet. For that, what we have to do? So we have to avoid the added salt into the various foods, like adding salt in curd, something like that. We have to avoid. And whenever you are taking some processed food, we have to always look for what is the salt content and what is the nutritive value of the food. Usually, the salt content is high in the processed foods and pre-kills like that. So it is better to avoid all these foods and maintain the low salt foods and targeting the salt less than 1500 milligrams per day. To do that, we have to make a note what type of foods we are taking, what is the salt content of the food, like that we have to. And second thing, so changing lifestyles means, and again, the other thing what we regularly consume is coffee and tea. So how much we have to take it? Increasing number of coffee time like 3 4 times 5 times per day may lead to the problem. That means they may adversely affect the blood pressures and may lead to the high blood pressures and lead to the various pathological. To do that, it is always better to maintain the tea coffee levels around tea coffee between 2 to 3 times a day. More than that may adversely affect the blood pressure and may rise the blood pressure. And third thing, what we have to keep it in mind is taking more fiber. Fiber means it is an organic matter which presents in the various fruits and vegetables. If you take the more fiber, it will absorb the more antioxidants, and it absorbs the more bad materials from the stomach and will let it out. And taking the fiber, if you take before that, you have to take the more number of fruits, legumes like that, and some more vegetables we have to take like that. So at the same time, these are the various nutrition things what we have to take to maintain the health. At the same time, we have to shed some lifestyles like having cigarette smoking is one of the bad thing which may lead to the increased atherosclerosis, and which may lead to the increased energetic drive, and may cause the increased blood pressure, which automatically lead to the various things like various bad things that was come with the heart. So always better avoid this one, smoking. Another thing what we have to think regularly, other thing what we have to keep it in mind is alcohol intake. So better not to consume alcohol. If ever anybody is consuming the alcohol, it is better to limit to the at least less than 1 pint. That means less than 30 ml per day. If you take more amount of alcohol every day, it may increase badly affect your the hypertension and may badly affect your blood pressure and may lead to the various things like heart strokes and cerebrovascular like that. At the same time, so to do this, we have to maintain the various diets are prescribed by the World Health like that. One of that one is a DASH diet. That means dietary intervention to stop hypertension. What it says is in this condition, what it says, you always take less amount of the fats and less amount of the carbohydrates. At the same time, your diet should include more of grains and lean meats, and whereas fruits and total sodium intake is less than 1500 milligrams. At the same time, and maintaining diet is one thing where we have to keep the blood pressure in the normal levels. At the same time, you should not forget about the exercise. Exercise is another one which is which is regularly required and may lead to the keep the blood pressure to within the normal levels. So every person is asked to take a minimum of 15 to 20 minutes of exercise in the maximum number of days in a week. So exercise of minimum 30 minutes, a moderate exercise, not you need not to go for any severe exercise like strenuous running, like a moderate regular aerobic exercise, and at least minimum of 30 minutes a day, and at least minimum 5 days a week will improve the health. So maintaining good blood pressure is nothing but maintaining a good health and good healthy heart. So further, you have to adopt this type of healthy diet and healthy lifestyles. So what I say is always better low salt and low consumption of tea, coffee, better avoid cigarette and alcohol, and maintain regular daily activity, exercise, aerobic exercise to maintain the good health of the body. Okay, thank you.